over 28,000 laboratory confirmed monkeypox cases have been reported since January 2022, and 12 deaths have been recorded from 89 countries. Now, 2 weeks ago, the World Health Organization declared monkeypox a global health emergency. To give us a picture of where we are here in South Africa with regards to monkeypox cases, we're now joined by Professor Adrian Puren, who's the Executive Director of the National Institute of Communicable Diseases. Prof, thanks very much indeed for joining us. So where are we in terms of monkeypox cases in South Africa, confirmed and otherwise?
Yeah, so for now, Peter, we're still at 3 confirmed cases since the initial reports. There have been no further described cases, and it may well be that there could be ongoing transmission, or it may have reached a dead end. It's difficult to tell. We certainly have expanded testing to include the private sector, and we wait for monkeypox to be declared a notifiable medical condition, which may well assist in some of the reporting. But at this stage, yeah, we only have 3 confirmed cases. These are 3 separate, unlinked cases. 2 of the cases have no travel history at all, so it's likely an importation. The 3rd case was, in fact, an individual from, I think, Switzerland, who arrived, but when he arrived, actually was already symptomatic and had a rash. So it's likely that he was infected outside of South Africa. And yep, that's where we are currently. Yes.
All right, so our borders are on alert to look out for this on top of everything else. And I suppose this helps us a great deal to manage this. But also, I guess, it is a condition that we would have to import in South Africa. So still at this point, no need to be unnecessarily alarmed.
Absolutely. I think the risk for South Africa remains low. I know that for worldwide it is medium, but I think for South Africa it remains low. And I'm sure even for groups that are probably at higher risk, this is not, it is important that those groups at risk that have been described elsewhere become alert and be aware. But I think it's our entire population is susceptible. I don't think we can just be complacent and thinking that we were not at risk. So it's really important that and that's the whole purpose of that announcement by the WHO, is really to try and educate the public, educate healthcare workers, educate high-risk groups around this particular infection, and that we are prepared for it, and that we provide, for example, diagnostics, as well as the ability, and the diagnostics, as I've already said, has been expanded to the private sector as well. And also, in order to ensure that we are able to do the appropriate tracing and tracking, in order to ensure that cases that have been identified or potential cases do monitor their symptoms and present for diagnostics and appropriate care where needed.
All right, and unlike COVID-19, it doesn't quite spread in the same way. So whilst it might be a global concern, it's not of the same nature in terms of pandemic behavior.
Yes, absolutely. So this is not compared to COVID-19, this is not a highly transmissible virus. It's thought that very close skin-to-skin contact, in particular, in these particular settings, and that's what is, I think, unique around this current outbreak, is that we have such large numbers of human-to-human transmission, and it really requires skin-to-skin contact specifically for transmission to occur. Again, there's some controversy and debate around close face-to-face contact and respiratory droplets. It's possible that may occur, but I think that the skin-to-skin contact is important, as well as the so-called fomite transmission as well. In other words, linen or other surfaces that have been exposed to the virus or have the presence of the virus are also possible potential sources of infection.
Where are we in terms of vaccines? I know smallpox was seen as something that could offer some kind of protection. Is there a monkeypox vaccine?
I think there is, if I understand correctly, but I think there are at least one vaccine that could possibly be available. But again, in terms of worldwide distribution and access, I think that's really going to be, I think, a really difficult task. As we've already experienced, I think, with COVID-19 in some ways. So I think the main focus really for South Africa is to try and maintain this low risk scenario, ensure that individuals who feel that they have been exposed are able to get themselves tested, that we have the appropriate tracing and contact mechanisms available. Because I think access to vaccine, in fact, there are also antiretrovirals that could possibly be of use. But again, these are going to be of limited supply. I know just in the UK, for example, just coming to your point about vaccines, they may even run out of vaccines within the next 10 days, for example. So I think it's going to be quite a challenge to have access to vaccines.
All right, perhaps not as rapid spreading as COVID-19, but is it something that can be contained?
But I think that there must be greater efforts, of course, to try and contain this. I think there's much debate, I think, in, for example, Europe, UK, and the United States around access to testing, for example. I think that's really a key factor that really was thought to slow down the ability to identify cases early on. And given that it's not a highly transmissible virus, I think the ability to try and stem this is really critical. But again, as we know with COVID-19, even though we had recommended, for example, isolation of cases, this can become very difficult. How practical is it to actually isolate individuals in a household if they don't have access, or it's difficult to do that in a household? What happens next? So I think these are also really practical considerations. I think also with this particular virus, again, I think it's unfortunate in terms of the naming of the virus, as well as the initial networks and social and sexual networks that this virus was associated with, also heightened stigmatization as well. And I think those particular factors may also contribute to our difficulties in terms of stemming this. And of course, the added complication is that, yes, there is a vaccine, which really puts us in better stead than, for example, COVID-19. But again, the availability of the vaccines is really a challenge.
All right, what do we know about the pathology of this virus? Does it mutate? Has it been pretty consistent over time? Because I guess that makes half the battle much easier, doesn't it?
Yes, so it's very interesting, Peter. It's a DNA virus. So again, the rates of mutation are thought to be slow, but it's very interesting that, in fact, there has been a shift in some of the mutations. I think there are about 50 mutations compared to an earlier strain. So it's really thought that this particular strain, clade rather, has been in circulation longer than we think it has been in terms of human-to-human transmission. However, again, it's not clear, but it's thought unlikely that these mutations have led to changes in transmissibility, for example, that there's more rapid transmissibility. It's not thought that the changes that are being observed. So although there are changes, it's very different to what we've seen with COVID-19, where, as you know, those particular mutations have played an important role with regard to transmissibility and pathogenesis. But these current mutations with regard to smallpox are thought not to contribute to any changes in transmissibility or in terms of presentation. However, it's very interesting that I think we've probably learned a bit more in that, in fact, you may have the rash prior to symptomatology. And again, just a single blister could appear. That could be pathognomonic for the fact that you may have monkeypox. So again, I think people are learning in terms of clinical presentations, and I think that's why it's important that announcement of a public health emergency really galvanizes the sharing of information, sharing of experiences, and of course the readiness for the broader public to be aware of this particular infection.
All right, let's leave it with a message to the public. Precautions that one can take, and also what to look out for in terms of symptoms that might say, maybe I need to go to see a doctor.
Yes, I think it's really, as I said, we've certainly seen outside of South Africa and outside of Africa, for example, that the presentation has been in specific social and sexual networks. So I think, again, I think it's very important that even within South Africa that there's an awareness of that, but that the general public, again, should not be complacent. So the general symptoms, again, are severe fever, muscle pain, fatigue, and this is a prodrome after an incubation period of up to 21 days, but it can be shortened to about 5 to 10 days. And what happens then after this incubation period is the presentation of, as I said, the symptoms, followed by rash. And this rash can again start either in the face and extend through the body, or it can be in specific areas such as the anogenital areas, for example, or in the hands, as classical cases. And again, it varies in terms of the numbers of macular papular rashes that you, blisters that you can actually see. And again, very importantly here is that if there is a rash, get that investigated to try and exclude, because again, if there's a differential diagnosis, and so chickenpox is really the other key differential that needs to be included, in syphilis as another example, to be excluded from the diagnosis. Now, I know it's described as being a mild disease. In other words, many people do not require hospitalization, but I'm sure it's really uncomfortable in terms of the rash itself. And it does take 2 to 4 weeks, again, to heal. And during that healing phase, a person can still transmit the virus in terms of close contact. And again, in households where there has been a diagnosis, as I said, isolation I know is challenging. And so again, if there are opportunities not to share, for example, close contact, sharing bed linen and other surfaces that need to be cleaned, I think that's really going to be critical elements to manage the actual infection during the isolation period. And again, I think we need to acknowledge that isolation is not an easy matter to actually introduce, but it's something which we need to consider.
Prof, and that's where we'll leave it. Thank you very, very much indeed for joining us on the programme.
Thank you. Thanks for the opportunity.
That's Professor Adrian Puren, who's the Executive Director of the National Institute of Communicable Diseases, giving us an update on the monkeypox situation in South Africa. 3 confirmed cases, but we still need to be diligent and take all the precautions and get tested if you start to present any of the symptoms that he described.